Hi, this is Jim from Safety Wars. Before we start the program, I want to make sure everyone understands that we often talk about OSHA and EPA citations, along with some other regulatory actions from other agencies, legal cases, and criminal activity. Everyone is innocent until proven guilty in a court of law. Proposed fines are exactly that, and they are often litigated, reduced, or vacated. We use available public records, news accounts, and press releases. We cannot warranty or guarantee the details of any of the stories we share, since we are not directly involved with these stories. At least not most of the time. Enjoy the show.
This show is brought to you by Safety FM.
Hello, Safety Wars for, what day is it? Monday, August 3rd, 2026. This is an unusual Monday program, but it's an unusual Monday. I wanted to get this out last week, but I needed to make sure we had it right. As usual, we will be one of those unique points of view that you're going to see on this whole subject. And unfortunately, we all are involved in this situation. What am I talking about? We're talking about what happened last week with the Dr. Fauci hearings. And we have a whole bunch of stuff to talk about here. We touched on this last on Thursday, but I wanted to give a more mature, maybe that's the wrong word, but a more comprehensive outlook here. Again, we can have a little bit of hyperbole, but this is a very serious situation here. So we're not going to be joking around as we normally do. We don't have our sarcasm or wit or anything else. So I'm just going to go with it. This is Who Enforced the Pandemic? COVID-19, Accountability, and the Safety Professionals Left Behind by Jim Posel. This is our monologue for today. It's going to be a rather long one. Don't plan on doing anything else, and we might run overtime. With this, if we run overtime, you know where to catch us on the podcast or video platform. So, a lot of things we're going to say. Welcome to Safety Wars. And one reminder throughout this whole thing. Safety requires capacity. Resilience is how we use it. Accountability means remembering who was required to enforce it. And we will be talking about other accountability issues. Welcome to Safety Wars. Today we are discussing Dr. Anthony Fauci's appearance before the Senate Committee on Homeland Security and Government Affairs, chaired by Senator Rand Paul last week. There has been a lot of questions, a lot of hyperbole, and a lot of rhetoric. There is a time and place for that, but where do we go from there? Especially with 1.2 million plus fatalities due to this illness, and everybody was impacted. Everybody was affected. We're going to be seeing the impacts of this for decades to come because of the social fallout from this and political fallout also. The hearings concerned the origins of COVID-19, federal funding of coronavirus research, pandemic restrictions, vaccine policy, and whether government officials gave the public an accurate account of what was happening behind the scenes. This was, in effect, an indictment last week, not a full-blown prosecution. This was only the only forum of accountability that we will get in this situation. Pardons have been issued. Sovereign immunity, as usual, is always in effect. Let me start here by saying pain for pain does not work. A concentration on counterfactual information, that is, what should have happened, is a very limited use for the future. It's a very limited use for the past also. We need to be learning the lessons from COVID-19, not looking back. And as safety professionals, no matter what level we need to take the lead on, we need to take the lead on. We need to be leaders, not only in our workplaces or in our communities. And I'm going to fast forward to my call to action because most people only want to listen to the beginning, not the full-blown thing, usually. Here's the call to action. Document what happened. Write down what you were asked to enforce, what worked, what failed, and what it costs your workforce and community and your family. Then turn those lessons into preparation. Educate yourself and others about respiratory protection. Demand honest communication about uncertainty. Build real capacity, equipment, trained people, ventilation, reliable data, and clear authority, and create resilient systems that can adapt when the evidence changes. Safety professionals cannot wait for the next emergency to lead. Speak up and act now. Ask who has the authority. Doesn't matter whether you're dealing with a pandemic or anything else. Who bears the consequences? Who will accept responsibility for whatever decisions we make? And insist that future policies protect both public health and individual rights and worker rights. Do not pursue pain for pain. Pursue truth, preparedness, and reform. Remember what happened. Learn from it, prepare for what comes next, and lead. Make the safety war yours. Let's remember, a lot of people are still hurting out there. What was the hearing about? Republican senators accused Fauci of publicly dismissing the possibility that federally funded research in Wuhan contributed to the pandemic while privately expressing doubts about the virus's origin. They questioned Fauci about NIH funding provided through EcoHealth Alliance, research conducted at the Wuhan Institute of Virology, missing or deleted records, potential financial conflicts, vaccine injury information, and differences between his public statements and private writings. These were accusations raised during a political hearing. They are not all established facts. Fauci invoked the Fifth Amendment 111 times in response to the committee's questions. That frustrated senators, particularly because President Biden had issued him a broad federal pardon covering conduct from 2014 through 2025, his retirement. Committee members argued that the pardon removed his risk of federal prosecution and therefore eliminated his need to remain silent. Legally, obviously, it's more complicated than that. A federal pardon may not eliminate exposure to state prosecution, conduct outside the pardon's scope, or liability arising from new testimony. Invoking the Fifth Amendment is also not by itself proof of guilt. Still, the result was that the hearing produced far more confrontation than explanation. Democratic senators characterized the proceeding as a partisan effort to place the failures of an enormous government response on one person. They also argued that it distracted attention from present-day public health issues. The hearing eventually deteriorated into a confrontation involving Fauci's attorney, who was removed after attempting to intervene. The committee then announced plans to consider holding Fauci in contempt of Congress. The only remaining venue for accountability? The hearing was chaotic, partisan, and uncomfortable, but it may also have been one of the few remaining venues in which these questions could still be raised publicly. That point should not be dismissed. People seeking accountability face multiple legal barriers. Sovereign immunity can limit lawsuits against the federal government unless Congress has authorized them. Government officials may possess additional defenses for actions taken within their official duties. Statutes of limitations eventually close the door on many civil and criminal claims. Executive pardons can eliminate federal criminal exposure for conduct within their scope. These protections exist for legitimate constitutional and institutional reasons. Government could not function if every disputed decision automatically exposed an official to personal liability. But when sovereign immunity, official immunities, expired limitation periods, and pardons operate together, public may be left with no courtroom, no trial, no discovery process, and no opportunity to hear evidence tested under oath. A congressional hearing may then become the only available forum for accountability. That does not make every accusation true. It does not excuse partisan theatrics, and it does not transform political claims into proven facts. but it does explain why the hearing mattered to people who believe that no other institution will examine what happened. More importantly, did it teach us anything that will make the country safer during the next emergency? So in summary, did the hearing really provide accountability or merely pain for pain? Did it establish facts or did it produce a political spectacle? Influence is not the same as legal authority. Fauci was one of the country's most influential public health advisors. He directed the National Institute of Allergy and Infectious Diseases and later became the president's chief medical advisor. His words affected national policy and public behavior, but he did not personally close every school, business, church, beach, and playground. Presidents, governors, mayors, health departments, school boards, employers, and regulatory agencies made and enforced those decisions. That distinction matters. If we all place responsibility on one public figure, everyone else who exercised authority escaped scrutiny. There are nevertheless serious questions about the advice Fauci and other federal officials provided. Let me add this also. Oftentimes, when we issue, as we know this in the safety world, when there is a standard issued, when there is a standard of care issued, when there are court cases completed, often that becomes the standard of care and gets incorporated into what we do for company policy. They expanded this to public policy. This should have not been a surprise if you are a safety professional. Masks, 6 feet, and airborne transmission. At the beginning of the pandemic, the public was discouraged from routinely wearing masks. Officials later reversed that position. We're going to talk a lot about this here, and recommended widespread masking. Recommendations can legitimately change when evidence changes. The problem was how the change was communicated. Officials could have said, masks may provide protection, but supplies are limited and the healthcare workers urgently need them. Instead, early statements sometimes sounded as though masks simply did not work, or that was all you would have to wear and your risk goes to zero and you'll be protected. This misdefinition of what safety is zero. Completely a misdefinition. It does not take into account human behavior, how people actually use the masks, and that unless they were NIOSH rated masks as NP or R, along with the ASTM rating for liquids or fluids, they were of limited effectiveness. All of that damaged public trust. Then there was the 6-foot distancing rule. Many of those signs are still there and decals on the floors of your favorite restaurant or supermarket. 6 foot became an almost sacred number. It determined where people could stand, how businesses operated, whether classrooms could reopen, and how workplaces were redesigned. But 6 feet was never a magical boundary between danger and safety. Fauci later acknowledged that he did not know what specific evidence supported the rule and said that it appeared in CDC guidance. A precaution can be reasonable without being presented as scientific certainty. The failure was not necessarily using 6 feet as an emergency guideline. The failure was neglecting to explain its uncertainty and limitations. Officials also took too long to emphasize airborne transmission. Early policy concentrated on droplets, disinfecting surfaces, installing plastic barriers, some of which are still in place, and keeping people at a specified distance apart. Meanwhile, evidence increasingly indicated that inhaling fine airborne particles, particularly in poorly ventilated indoor spaces, was a major route of transmission. We spent an enormous amount of time cleaning surfaces while giving insufficient attention to ventilation, filtration, outdoor activity, and properly fitted NIOSH-rated respirators. This was not simply an academic disagreement. It affected how schools, hospitals, businesses, and workplaces spent limited resources, and I will say homes also. Because you do know, especially in the safety business, a recommendation or guidance often becomes the legal standard or the best practice. Veer away from the best practice and you automatically become liable in many cases, or at least come under scrutiny. Where were the CDC's respirator experts? CDC did not need to search outside the federal government for respirator expertise. NIOSH, the National Institute for Occupational Safety and Health, is part of the CDC. Within NIOSH, the National Personal Protective Technology Laboratory approves respirators, studies filtration and fit, evaluates respiratory protection programs, and maintains the technical knowledge needed to distinguish a respirator from an ordinary mask. So where was that expertise when national masking policy was being designed and explained? That is a legitimate question for the senators. Why were respirator specialists not placed at the center of the public conversation? That also is a question for the senators. Why did Americans hear so much about face coverings and so little about filtration efficiency, facial leakage, fit testing, medical evaluation? Let's remember, during my mother-in-law's funeral, someone had a seizure wearing a mask while they were carrying the coffin. So this hits near and dear to me. User seal checks, facial hair, training, and the difference between source control and personal respiratory protection. Public was told to cover its face, but was rarely taught how respiratory protection actually works. This technical gap is one of the reasons we started this program, Safety Wars. I thought it was kind of weird that we were dealing with what was communicated as the most deadly virus ever to hit the planet Earth, and we were told to wear face coverings. A respirator only works when it fits. A NIOSH-approved respirator can contain excellent filter material and still provide poor protection when worn incorrectly. If the respirator does not seal against the face, contaminated air travels around the filter instead of through it. People wore respirators below their noses. They left large gaps around their cheeks. They repeatedly touched and repositioned them. They used ear loop devices that were not NIOSH-approved respirators. They wore facial hair across the sealing surface. They reused damaged or soiled equipment. I'll give them a break on that because there wasn't enough to go along. They selected whatever model was available without knowing whether it fit their face. I'll give them a break on that too. There wasn't enough to go around. There was a shortage. Starting in September 2019, that is when I knew that something was going on, when there were PPE shortages, starting way before the official stuff going on. Then public discussions treat a device as though its certification number automatically represented the protection received by the person wearing it. It does not. The laboratory performance in the filter is only one part of respiratory protection. Real protection depends on selection, fit, condition, training, proper use, and consistent wear. A P100 filter may remove at least 99.97% of the test aerosol under certification conditions, but if the face piece leaks, the wearer is not receiving P100 level protection. That distinction should have been explained from the beginning. An N95 worn correctly can provide meaningful respiratory protection. A N95 hanging below the nose gives you nothing. Face coverings, source control, and the respirator shortage. Instead, the government largely adopted the language of masks and face coverings. Those devices were primarily presented as source control, something intended to reduce material expelled by the wearer. They were not necessarily tested, approved, fitted, or capable of providing the wearer with a dependable level of respiratory protection. CDC acknowledged in 2020 that cloth and medical masks were not respirators and that limited supplies of NIOSH-approved respirators needed to be reserved for workers who relied on them. The shortage was real. There were not enough approved respirators for everyone, but there was another workplace complication. What mandatory respirator use really requires? If an employer requires workers to wear respirators for protection against a workplace hazard, OSHA's Respiratory Protection Standard, 29 CFR 1910-134, generally comes into play. That is not simply a requirement to hand an employee an N95. The employer may need a written respirator protection program, a qualified program administrator, hazard evaluation, correct respirator selection, employee training, medical evaluation, initial and annual fit testing, procedures for inspection and replacement, record keeping, and continuing evaluation of whether the program works. The employee must be medically evaluated before fit testing or required to wear the respirator. If a tight-fitting respirator is used, the employee must pass the appropriate fit test. The employee must also conduct a user seal check each time the respirator is put on. Some workers may not be medically able to use a negative pressure respirator effectively. Breathing resistance, heat, physical exertion, underlying cardiovascular or respiratory conditions, and the demands of the job all matter. In some cases, a powdered air purifying respirator may be an alternative, but that introduces additional costs, training, maintenance, and logistical requirements. The proposed emergency response standard generated similar criticism because it's contemplated medical fitness, training, equipment, and program requirements could impose substantial burdens, particularly on small, rural, and volunteer emergency response organizations. Protecting responders is essential, but a standard that organizations lack the personnel or money to implement may reduce the operational capacity or exclude experienced people who cannot satisfy its requirements. That there is the tension safety professionals should understand. A rule can be protective in theory and still create serious operational consequences in practice. I'm going to say this. We still have people that are walking around wearing face coverings thinking that they're respirators. And are they protecting themselves? Maybe, maybe not. We don't know. Things are not rated. Again, I have the experience of someone putting on a face covering and having a seizure of some sort with that. Also, I question whether or not if you are in that poor of health that you have to wear a face covering, that perhaps are you medically evaluated for? Are you medically capable of wearing? The reason why I bring this up is there are a lot of people out there who are, I think, not realizing that they are giving themselves limited protection with this stuff. And if we're worried about source control with this, which is what a mask is supposed to be, is source control, do they realize that they're not necessarily protecting themselves? I don't know. All those are questions that need to be asked, right? But let's go further than that. Regulatory effect of calling it a face covering. Calling something a face covering instead of required respiratory protection avoided much of that regulatory structure. Ordinary face coverings could be distributed without individually selecting a respirator, medically evaluating the wearer, conducting an OSHA-accepted fit test, or administering a complete respiratory protection program. We should be careful about claiming that avoiding OSHA compliance was the government's proven motive. The documented respirator shortage and the goal of the source control were genuine considerations, but the practical effect is undeniable, and I don't believe necessarily in coincidences all the time. Recommending face coverings allow mass masking without requiring the country to supply hundreds of millions of approved respirators or requiring every affected employer to immediately implement every element of 1910 Weather 34. Under normal circumstances, and I know this from personal experience, if you have a biohazardous substance that is airborne, you're going to be in a NIOSH respirator in your workplace. That's what it is. Anything less than that, you're probably going to get fired, decredentialed, or put in jail. Way it is. Or you're at minimum, possibly a lawsuit. That may have been administratively necessary during the emergency, just what I just mentioned. It also created confusion that continues to today. People began treating masks, face coverings, surgical masks, KN95 style products, N95 respirators, and P100 respirators as though they were interchangeable. They are not. The government blurred three separate questions. Does the device reduce material released by the wearer? Does the filter material remove particles from inhaled air? Does the complete device fit the individual well enough to provide reliable personal protection? Those questions require different evidence. A loose face covering may offer some source control without providing dependable respiratory protection. A high-quality respirator may have excellent filter media, but fail because it does not fit the wearer. A properly selected and fitted respirator may work extremely well, but become ineffective when worn incorrectly or inconsistently. This is exactly where qualified safety professionals and NIOSH respirator experts should have shaped the national message. What the public should have been told. Again, this is counterfactual, but again, use this to prepare for future use, for future emergencies. What the public should have been told. Instead of merely saying, wear a mask, the message should have explained the hierarchy. A face covering is not necessarily a respirator. A certification applies to an approved respirator configuration, not to every product that resembles one. There's a lot of fake ones out there. There's a lot of fake ones out there still today. Filtration is not the same as fit. Fit is not the same as correct use. Correct use once is not the same as consistent protection throughout a shift. Requiring workplace respirator use creates responsibilities for the employer that cannot be satisfied by placing a box of N95s near the entrance. These are not minor technical details. These details determine whether respiratory protection actually protects anyone. Safety Wars was created in part to address this type of failure. The distance between a rule written at the top and the reality experienced by the person expected to implement it. We needed respiratory science, workplace reality, regulatory knowledge, and honest risk communication at the same table. Instead, safety professionals were frequently handed generalized guidance and told to turn it into enforceable workplace policy overnight, oftentimes with them knowing that it was wrong, meaning wrong technically and possibly wrong legally and possibly wrong morally and scientifically. Schools, vaccines, and prior infection. School policy presents another difficult issue. Initial closures occurred during a genuine emergency involving an unfamiliar virus. The closures continued after their educational, developmental, psychological, and economic consequences became clearer. Children lost instruction. Families lost stability. Inequality increased. Some students still have not recovered. I'm a witness to that. Fauci did not personally close these schools, but federal public health leadership often represented the cautious side of the debate. The question is whether it adequately balanced infection control against the harm caused by keeping children out of classrooms. Vaccination presents a similar need for careful distinction. COVID-19 vaccines substantially reduce the risk of severe illnesses, hospitalization, and death. That is an important achievement, but public messaging sometimes implies that vaccination would reliably prevent infection and stop transmission. That became progressively less accurate as immunity waned and new variants emerged. Public health leaders should have clearly separated protection against severe illness from protection against infection. They should have also explained that the strength and duration of each form of protection could change. Policy gave limited recognition to immunity following infection. Evidence eventually demonstrated that previous infection provided meaningful protection, while vaccination after infection could provide additional protection. That did not mean people should intentionally become infected. Infection carried greater risks than vaccination often. But it did mean that previously infected people had a different risk profile, and policy should have acknowledged that distinction. And I will add this disclaimer that follow the advice of your doctor, whether you're going to get a vaccination or not, whether it is appropriate for you. Research, oversight, and the Wuhan question. Then we come to federally funded coronavirus research. NIAID, right, that's what Fauci was the head of, funded EcoHealth Alliance, which provided money to the Wuhan Institute of Virology. A federal inspector general investigator later found important failures, allegedly, in how the NIH and EcoHealth monitored those grants and obtained required information. That is a legitimate oversight failure. It does not automatically prove that research created SARS-CoV-2. It does not prove that Fauci caused the pandemic. It does mean that agencies supporting potentially consequential research must be capable of monitoring the work, enforcing reporting requirements, and obtaining underlying records. If the agency cannot independently verify what a foreign laboratory is doing with federal money, then it does not possess adequate oversight capacity. I'll add this, perhaps by design. The safety professionals eventually were left holding the bag. But the story does not end in Washington. The consequences reached every workplace in America, and workplace safety professionals were placed directly in the line of fire. Safety managers, industrial hygienists, environmental health and safety professional, human resources employees, supervisors, nurses, and frontline managers were designated to implement and enforce rules that they did not create. We enforced distancing requirements that were later questioned. We enforced masking policies that were later questioned. We conducted screenings and contact tracing, often with little or no guidance. Also, when someone did get sick, they were blamed, that they did something wrong. Does that sound familiar? Blame and shame, and of course, retrain. And give a week off, because we're not sure whether you're sick or not. We separated work crews. We conducted screenings and contact tracing. We restricted access to buildings. We sent employees home. We participated in disciplinary decisions. Some workplaces, we helped terminate employees who would not comply. We made coworkers and friends uncomfortable because the organization told us that enforcement was necessary to help protect everyone else. Then when policies changed, many organizations behaved as though those rules had appeared on their own. The executives who approved the policies moved on. The agencies revised their guidance. Politicians changed their language. But the safety professionals still had to walk through the same facility and face the employees affected by those decisions. We became the human face of rules written somewhere else, as usual. Employees did not argue with federal guidance documents. They argued with the safety manager standing at the entrance. They did not direct their anger toward distant officials appearing on television. They directed it towards the person telling them to put on a mask, remain 6 feet away, submit to testing, leave the workplace, or risk discipline up to and including termination. Safety professionals were blamed from both directions. Workers blamed us for enforcing the rules, while management blamed us when enforcement produced conflict, complaints, staffing shortages, or legal exposure. Some safety professionals are still dealing with the consequences. Damaged relationships, diminished credibility, grievances, litigation, workforce division, moral injury, and distrust of future health guidance. That fallout is part of the pandemic record. It cannot be dismissed with the phrase, the science changed. Changing science may explain why guidance evolved. It did not erase what people were ordered to do under previous guidance, and it does not repair the professional relationships damaged during enforcement. Capacity, resilience, and accountability. That brings us to the central safety wars lesson. Safety requires capacity and resilience. Capacity means having the resources needed before an emergency begins. Respirators, filters, ventilation systems, testing capabilities, trained personnel, domestic manufacturing, surveillance, reliable data, and clear lines of authority. At the beginning of the COVID-19, we lacked sufficient capacity. We did not have enough respirators for healthcare workers, much less the wider population. That shortage influenced public messaging and forced organizations to conserve equipment. Resilience is how intelligent we use and adapt that capacity. A warehouse full of masks is not resilience. We also need systems for distributing them, selecting correct protection, fit testing workers, explaining limitations, evaluating changing evidence, and revising strategy without pretending the original policy never existed. Capacity is possessing the equipment. Resilience is knowing what to do with it. Accountability is remembering who was required to enforce it. Workers were placed in an impossible position during the pandemic. Management created rules and instructed employees to enforce them. Members of the public became angry with the workers standing in front of them. Later, some employers blamed those same workers for how the rules had been enforced. The people with the least policy-making authority absorbed the most anger. That is a failure of leadership, my friends. Now let's talk about this. Pain for pain is not a safety review. Senator Bernie Moreno described extreme enforcement incidents and demanded to know who officials thought they were, he didn't use those words exactly, to impose such restrictions. The anger behind that question is understandable. People experience loss, isolation, humiliation, denigration, interrupted education, destroyed businesses, and rules that sometimes appeared arbitrary or ridiculous. Anger alone does not build a safer system. A hearing based on political pain may return pain to the people blamed for past decisions, and may even expose contradictions that deserve investigation. But pain for pain is not the same as accountability, although it may feel good at first and be good for sound bites. Real accountability asks harder questions. We have a list of questions here that's rather extensive. What information did officials possess at the time? Which decisions were supported by evidence? Which were precautionary judgments? Who possessed the legal authority? What competing harms were considered? When the evidence changed, how quickly did the policy change? Were dissenting experts heard? Were records preserved? Apparently, this time, maybe yes, maybe no. Who benefited financially? What safeguards failed? Who ordered workplace enforcement? Who carried it out? Who accepted responsibility when enforcement harmed employees? And perhaps one of the most important questions, what will we do next time? The most valuable question that could have been put to Fauci was simple. Knowing what you know today, what would you have done differently? He pleaded the fifth, as I recall on that. The next question should have been even more important. What should the country do now to prepare for the next pandemic? I believe the Democrats brought that up. A Democrat brought that up. And that is a legitimate question. What do we do next? Those questions do not excuse misconduct. They are how an investigation becomes a safety review rather than a public spectacle. The final lesson. The fair criticism of the COVID response is not that every precaution was useless, that every official acted maliciously. The stronger criticism is that uncertain judgments were sometimes presented as settled science, policies were not always adjusted quickly enough, collateral harms received inadequate consideration, and agencies demanded public trust without consistently providing public transparency. The lesson for the future is not to abandon public health. It is to build public health that deserves public trust. Let me repeat that. The lesson for the future is not to abandon public health. It is to build public health that deserves public trust. That means evidence without arrogance, precaution without pretense, authority with accountability, and safety systems designed around both capacity and resilience, not the zero sign. It also means remembering the safety professionals who were ordered to enforce these policies and then left to manage the consequences. Because in the safety war, accountability cannot stop with the person who delivered the rule. It must reach the people who created it, authorized it, enforced it, and lived with its consequences. So, as we close, do not let this history disappear. Preserve the record of what happened in your workplace and community, what you were ordered to enforce, what protected people, what failed them, and what those decisions cost, both financially, morally, ethically, and relationship-wise. But do not stop at remembering. Turn experience into preparation and action. Strengthen your knowledge of respiratory protection and government policy concerning disasters. Build capacity before the next crisis arrives. Prepare the equipment, training, ventilation, data, and clear lines of authority that effective safety demands. Create resilient systems capable of changing when the evidence changes, and leaders willing to acknowledge why. When the next emergency comes, and it will come, safety professionals must take more responsibility. We have to have a voice in the process. Ask who holds the authority, who carries the consequences, and who will answer for the decisions. Demand policies that protect public health without abandoning transparency, individual rights, or the people expected to enforce them. Accountability is not about returning pain for pain. It's about discovering truth, correcting what failed, and refusing to repeat the same mistakes. Remember the past, prepare for the future, step forward and lead. Make the safety war yours. Thank you. This is Jim Posel signing off.
The views and opinions expressed on this podcast are those of the host and its guest and do not necessarily reflect the official policy or position of the company. Examples of analysis discussed within this podcast are only examples. They should not be utilized in the real world as the only solution available, as they are based only on very limited and dated open source information. Assumptions made within this analysis are not reflective of the position of the company. No part of this podcast may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, mechanical, electronic, recording, or otherwise, without prior written permission of the creator of the podcast, Jay Allen.